Hi everyone, Dr. B here. Welcome to my channel. Today I'm going to be talking about belly button hernia, also known as umbilical hernia. To help with this discussion, I have my daughter here, Salma. Salma, say hi. Okay, so um, let me tell you a little bit about myself real quickly. Like I said, I am Dr. B. I am a surgeon. I take care of children, so I'm a pediatric surgeon. This is what I do, and I like to talk to people about surgical diseases in a way that is easily understood by everyone. So, with that said, let's jump right in. So, what is belly button hernia? Well, as you know, when babies are born, they have an umbilical cord that sticks out of their belly button. And when that closes off and it falls off, sometimes there's a little defect that is left in that area. In fact, in up to 25% of African American or Black children, and up to about 15% of children of Caucasian descent, you can have them have that defect known as umbilical hernia. So it's a pretty common condition. Um, and I keep saying the umbilical hernia or in the umbilicus. And Sama, do you want to show everybody your belly button? Yeah, look right there is your belly button. Okay, Sama does not have a belly button hernia, but let's say she did. When a child comes into the hospital, you look at their belly, you look at whether they have an outie or an innie, and you kind of feel around there to see if there's a defect. There's no defect here right now, but in children that have defects or hernias, you can kind of feel it. Thank you, Salma. And usually, the belly button hernias will close up in a lot of children. In fact, the current recommendation is that we fix it at the time when the child is ready for school. So around school age, around 4 years of age. Prior to that, surgeons just watch the hernias every year, or the pediatricians can keep an eye on it as well. And this is because, like I said earlier, most of these will close by themselves. So there really is no reason for surgery. Um, there's some hypothesis that explains why we fix the hernia when we do fix it. Some of it has to do with when the child goes from basically belly breathing to breathing with their chest, and so that kind of happens around age 4 and 5. But really, there's some cosmesis to it as well, and that has to do with trying to get it done before kids start school and before they become more aware, um, and take time off school and things like that. So the obvious next question is, how do we fix it? Well, most times, this is fixed by doing it in a day surgery. So you come in, you have the surgery done, and you go home. And it usually involves making a little cut under the belly button and looking for the hernia under the skin, removing the sac, or the part of the abdominal wall that contains the hernia itself, and then closing the defect with sutures. And then we usually will recreate the belly button and then sew up the skin and cover it with either skin glue or with some dressing. And most children do very well with this surgery, and healing is usually quite good. In terms of complications or things that can sometimes happen with the surgery, the things that you should know about is things that are common with any surgery, like bleeding, infection. There might be some pain associated with it. But surgeons are usually pretty well equipped to take care of this in the immediate postoperative period. For pain control, most children are fine with just some over the counter pain medications like Tylenol or acetaminophen, and usually nothing stronger is needed than that. This might be contrary to some of the things you have heard or have seen in adults who have had the same condition with an umbilical hernia and have had that repaired, because in adults, sometimes they use what's called a mesh to reinforce the area of fixation. In children, we generally do not do that, because this is a congenital type of hernia, and the mesh is something that stays in lifelong. So in most children with smaller hernias, we're able to repair it just with sutures, and that should take care of it. The other thing to think about is the possibility of it coming back. In a few children, the hernia can recur, and if that does happen, you just go through the process again. sometimes the question is there really a need to fix to fix the hernia? Yes, the recommendation is to fix the hernia because when you have a hole or a defect in your belly button, sometimes the intestines from the inside can actually pass through the hole and can get stuck in the hole. And whatever intestines or bowel gets stuck in that hole may not be able to return back to its normal place, and that can cut off the blood supply to that bowel that is stuck in there. If that happens, that piece of bowel can actually die and can make um, your child very sick. And that converts a situation that is elective to something that becomes an emergency. And so when a surgeon finds it and it's an appropriate time, meaning, around school age, 3, 4, 5, then the current recommendation is to go ahead and fix it surgically. I think this really explains, at least on a basic level, what hernia of the belly button is, why we fix it, how common it is, and how we do go ahead and take care of it. Okay, can we start again?